In this podcast episode, Kelsi Sheren discusses the controversial topic of medical assistance in dying, MAID in Canada, shedding light on the implications of this legislation and its moral ramifications. Sheren, a veteran and mental health advocate, argues that MAID is not merely a compassionate choice for those suffering, but rather a troubling symptom of a society that is increasingly willing to devalue human life, particularly among vulnerable populations. Sheren begins by explaining what MAID entails, emphasizing that it is often misrepresented as a humane option for those in distress. She argues that the reality is far more sinister, likening it to eugenics. The process involves a physician providing lethal drugs to patients, who must then self-administer them. Sheren highlights the painful nature of this method, countering the narrative that it is a peaceful way to die. She points out that the criteria for qualifying for MAID have expanded significantly since its inception, now including individuals with mental health issues, chronic pain, and even those who are homeless or struggling with addiction. Sheren discusses the slippery slope that has emerged since the introduction of MAID in Canada. Initially intended for terminally ill patients, the criteria have broadened to include those with non-terminal conditions, leading to a dramatic increase in euthanasia cases. She cites alarming statistics, such as the fact that Quebec has seen over 73% of its population euthanized in recent years. Sheren argues that this trend reflects a societal shift towards viewing certain lives as burdensome, particularly those of the mentally ill, disabled, and elderly. A significant portion of the conversation revolves around the ideological underpinnings of MAID. Sheren asserts that the push for euthanasia is not just about providing options for suffering individuals, but is also rooted in a broader societal belief that some lives are less valuable than others. She draws parallels between the rhetoric surrounding MAID and other controversial movements, suggesting that both are driven by a desire to control and eliminate perceived societal burdens. Sheren emphasizes that this ideology is dangerous, as it can lead to the normalization of death as a solution to suffering. Sheren raises concerns about the moral implications for healthcare professionals involved in MAID. She argues that by participating in euthanasia, doctors are being transformed from healers into executioners, which contradicts the Hippocratic oath to do no harm. This shift, she contends, not only affects the practitioners, but also the patients and their families, who may be left with feelings of guilt and helplessness after a loved one is euthanized. Throughout the discussion, Sheren advocates for improved mental health care and palliative options rather than resorting to euthanasia. She argues that the government should focus on providing better support systems for individuals struggling with mental illness, chronic pain, or terminal conditions. Sheren emphasizes the importance of community, purpose, and access to effective treatments, including emerging therapies like psychedelics, which have shown promise in treating conditions like PTSD and depression. Sheren also touches on the financial implications of MAID, suggesting that it serves as a cost-saving measure for the healthcare system. She argues that the government is incentivized to promote euthanasia as a way to reduce the financial burden of caring for individuals with chronic or terminal illnesses. This perspective raises ethical questions about the value placed on human life and the lengths to which society will go to cut costs. As the conversation progresses, Sheren expresses her concerns about the future of MAID and its potential expansion to include minors and individuals with mental health issues. She warns that if society continues down this path, it will lead to a normalization of death as a solution to suffering, particularly among vulnerable populations. Sheren emphasizes the need for public awareness and advocacy to combat this trend, urging listeners to engage in conversations about the moral implications of MAID. In closing, Sheren calls for a collective awakening to the dangers posed by MAID and the ideologies that support it. She encourages listeners to advocate for better mental health care, community support, and a reevaluation of the value placed on human life. By shining a light on these issues, Sheren believes that society can begin to shift away from the troubling narrative that devalues life and embraces a more compassionate approach to care and support for those in need.